Bismillahirrahmanirrahim. Assalamu alaikum wa rahmatullahi wa barakatuh. I am AbdulwahabMLT120192008, student of BSMLT at semester, Cohort, University of Science and Technology. Today's my presentation topic is typhoid fever. We will discuss typhoid fever. Let's start with outlines, introduction, causes of typhoid, symptoms, diagnosis of typhoid fever, treatment to be needed, prevention, complications, conclusion. The last slide. Start with the first slide. What is typhoid? Which bacterium cause typhoid fever? Typhoid fever is a bacterial infection affecting many organs caused by Salmonella typhi. It is a serious and potentially life-threatening disease. Once Salmonella typhi is ingested, they multiply in the bloodstream. There is only one type of typhoid fever caused by this specific bacterium, means Salmonella typhi causing only typhoid fever. Causative agents. Typhoid fever is caused by the bacterium Salmonella typhi. It belongs to Enterobacteriaceae family. Salmonella is genus of rod-shaped gram-negative bacteria. The bacteria are found in contaminated food, water, and feces. The bacteria enter the body through the mouth and travel to the small intestine. From there, they enter the bloodstream and can spread through the body. Symptoms through which we can identify the disease include fever, headache, fatigue, muscle aches, loss of appetite, and patient may also experience abdominal pain, constipation, and diarrhea. In severe cases, patient may develop a rash and experience confusions. How we will diagnose if we have typhoid fever? If we are medical laboratory technologist and a patient came with typhoid fever, how we will diagnose? Through blood, urine, and stool tests, we can diagnose typhoid fever. Vidal test, which detects agglutinating antibodies to lipopolysaccharide TO test, and flagella TH test. Also, a blood culture is the most reliable test for diagnosing typhoid fever. How we perform blood culture? Sample for typhoid culture and checked under microscope for typhoid bacteria. We take blood from patient and make culture for checking typhoid bacteria inside the blood. Other tests may be done to rule out other conditions with similar symptoms. Means like if we have any other condition, we will need more different tests. So these are figures. Figure number 1 shows the animated Salmonella typhi, means someone have made through website that Salmonella typhi is like that, while the figure 1.2 shows the actual organisms Salmonella typhi bacteria seen under microscope. Treatment to be needed. What treatment best for patients' health? Treatment of typhoid fever typically involves antibiotics, which works against microorganisms we are facing. Common antibiotics used to treat typhoid fever include ciprofloxacin, azithromycin, and ceftriaxone. You may also be given fluids and treatment directly into a vein through an intravenous drip. In some cases, patients may need to be hospitalized for treatment for their good health, best recovery, quick recovery. How we will prevent typhoid fever? First of all, it needs good hygiene practices. Wash your hands frequently with soap and water, especially after using the bathroom. Only drink water from safe sources such as bottled water or water that has been boiled. Avoid eating raw fruits and vegetables that may have been washed in contaminated water. Get vaccinated against fever if you are traveling to an area where the disease is common. The typhoid vaccine is available as an injection or as a series of capsules. Vaccination is important, through which means we can prevent a disease, we can avoid a disease. If you have been diagnosed with typhoid fever, take antibiotics as prescribed and follow good hygiene practices to avoid spreading the disease to others. What complications came with typhoid fever? Complications of typhoid fever can be serious and life-threatening. Why typhoid fever can be serious and life-threatening? Because severe cases, patient may develop intestinal perforation, which requires surgery, because in intestinal perforation, holes made inside walls of intestine. Patient may also experience neurological complications such as encephalitis and meningitis. These both are neurological complications. Conclusion. What we conclude after watching this presentation: first, that typhoid fever is a serious and potentially life-threatening disease caused by the bacterium Salmonella typhi. Their symptoms include fever, headache, fatigue, and abdominal pain. If we have these symptoms, we should go to the hospital. Treatment involves antibiotics and prevention involves good hygiene practice and vaccination. If you suspect you have typhoid fever, seek medical attention immediately for your best good health, for your best life. Thank you. If you have any question, you can text me on my Gmail.